We are going to load a presentation real quick, and I'm going to go through a presentation around the crisis we've been seeing in Manteo and in primary care in Manteo and also in the region as well. So we do thank our hospital board members for being on today, and sorry that our current COVID volume has moved us to our next tier, which is orange, and we can't meet in person. Until we see lower numbers again, I truly hope we can be together again in person very, very soon. I prepared a special report for you today related to family medicine Manteo and the access to primary care issues that you're well aware of and that continue to impact our community. We've been in close contact in recent weeks, and I thank you all for your leadership in this space. This information was developed with the questions we have received in mind. These questions are coming from patients who've been directly impacted, concerned citizens, other community leaders. I know you're also getting phone calls, and I appreciate you helping our community understand the challenges we're facing, as well as the work we're doing to restore and even expand care. First and foremost, I know you each share my deep concern about the lack of access to primary care. I know we also join in feeling deep empathy for the patients who've been directly impacted and who rightfully feel concerned about their ability to receive care. The information I'm about to share is to communicate true information about why we are in this situation, what we've been doing to try to avoid it, and what we will continue to do to recover in the long term. I know that despite the facts, many in our community are without access to primary care, and our friends in Manteo are hurt and angry. I acknowledge these also as facts, and I share their concern about the state of primary care close to home. Let's talk about the letter. Believe me when I say that no one at the Outer Banks Hospital and Medical Group wanted to draft, print, or mail the letter. We, myself and staff, did everything humanly possible to avoid having to send it because we knew how it would impact the patients receiving the news. But in the end, we just simply had no choice. Hiring temporary providers to provide care at Manteo Family Medicine was a stopgap measure to get us through until we could find a permanent replacement, something we've been persistently working on. When we learned that the temporary providers were not renewing their contracts, we were required by law to let the patients that they were caring for know that we could no longer provide their care. The law states that we have to give 30 days notice to patients when we can no longer provide care to patients. I provide the link to the North Carolina Medical Board rules that govern this so that you can have this information as a resource. Unfortunately, we had no choice but to send the letter. I want to share more about how we're assisting patients with care. The letter was mailed to 2,418 patients. And one thing I do wish we had done differently was to place the dedicated phone number higher in the letter so that patients saw it in plain view. We did provide a dedicated number for patients to call for medication refill assistance. Patients are calling daily, and we've helped hundreds of patients with medication refills. The clinical team from ECU Health is also helping more than 150 patients with complex needs. As you know, healthcare is a highly regulated industry, and unfortunately, we're only legally able to continue to provide medication refill assistance for a period of 30 days. It's worth mentioning here because our ability to help is legally limited. Out of desperation, which I understand, patients are asking why we can't move them to another provider in the clinic or system. I truly wish we could. It's just that all of our other doctors have full patient panels and cannot humanly take on new patients. It's just the reality of the situation. I can only imagine how it felt to receive this letter. I have an elderly father who is disabled with many chronic conditions. If he received this letter, I would have been devastated as well. People are asking why a list of primary care practices was included in the letter. To receive a list of other providers in Elizabeth City, Edenton, and Chesapeake must feel like a punch in the gut. I assure you and all the patients who received this letter, we're only trying to help. As a matter of normal operations, we maintain a list of all regional primary care providers taking patients, so we can provide this information when people call and we can't take them on as a patient. Even if we don't have access or the ability to provide your care, we want you to have care. But I have empathy with how that may feel to a person receiving this letter. Now, I don't have a doctor, and you want me to travel an hour? I'm so very sorry that this is currently our reality. And I wish we could quickly hire more temporary providers to replace the two that left until permanent providers are secured. The reality is, it is getting just as tough and competitive now to hire temporary providers as it is to hire permanent providers, even advanced practice providers. Even if one were available, it would take up to 90 days to legally bring them here. I wanted to talk about the letter first and provide some answers because the letter and how receiving it made people feel is important. We are compassionate people and we do care. I can't say it enough. No one in healthcare ever wants to send a letter like that. We are in the business of helping people. Now I want to clear up any concerns that we're closing the Manteo practice. We are not. In fact, for several years, we worked with the College of Albemarle to find a location on the Manteo campus to add healthcare services there. In the end, the location just didn't pan out. Now we're currently in conversations with other individuals with a plan to accommodate more primary care providers in the long term in Manteo with a larger site that will serve Roanoke Island well into the future. The best news I have to share today is that we have one physician under contract arriving late to mid-July of just this next month to practice at family medicine in Manteo. We began recruiting this physician in the summer of 21. In fact, we had our first recruiting conversation with this provider in August of 21, nearly 11 months ago. Recruiting providers is a marathon and not a sprint. We are not closing Manteo, and we mean it when we say we are committed to reopening access to those who have lost it. And we have a plan for those 2,418 patients who may want to come back to Manteo Family Medicine. This has been a top concern by the patients who received the letter. They have the right to ask, will they be the first to become patients again? Granted, it won't happen overnight. However, we'll be mailing another letter to those 2,418 patients who received the first letter. This letter will provide information about getting on a wait list to rejoin the practice. Once our new physician is here and the scheduling template is ready, we'll begin plugging patients into care using that wait list. So why are we in this pinch? You know, who's to blame? Why are doctors leaving? It's a human response I get. We looked at the history of physician turnover since 2017. It revealed that several have retired after a long career, several have made the change from primary care to urgent care, and several left the area to move closer to family and loved ones. We lost 7 providers when another healthcare system closed practices in Manteo and Kitty Hawk, and several non-hospital practices closed in the area. The reality you all know because we have been talking about it, and that's burnout. The pandemic took a toll on people, healthcare workers included. You know, people are also asking, why is it so hard to recruit providers? I mean, come on, this is the Outer Banks. We live in the most beautiful place on earth. I have to say, we're not alone. And it's just not about the housing crisis, although the lack of inventory and the prices are hurting us in recruitment. Primary care specialties of family medicine, internal medicine, and hospital medicine physicians are the most sought out after, yet lowest paid, making them the hardest positions to fill locally. As a matter of fact, there are currently over 3,800 openings for family medicine in North Carolina alone. In a recent presentation at the Conference for Physician Recruiters in the Carolinas, data revealed this year's graduating primary care residence class had an average of 90 viable job openings to consider in their respective markets. Locally, physician candidates have turned down offers because of the small selection of available housing, the high cost of living, or they'd prefer to live in a more metropolitan area. Although we dearly love it here, it's not always for everyone. We see that from a geographical standpoint as well as a clinical standpoint. Healthcare workers here are truly special because most are what we would call generalists. We have to do more with less. The primary care physician has to be a primary care doctor, a behavioral health clinician, a pulmonologist, a neurologist, and so on. This is not unique to other rural areas in America. In larger cities, those specialties are plentiful. Not everyone we interview wants to work in a small, rural, clinical environment is another reality that we are up against. So why can't doctors just open their own practice on the Outer Banks? Well, those who do, whether they want to work for us directly or not, we always try to help. We've assisted several practices outside of our medical group when they have requested it. For instance, we helped Beach Medical find a new home when they had to leave Kitty Hawk years ago. We recently received a call from a practice interested in coming here, and we connected those primary care providers with a local realtor that we knew who already had some medical space available. The reality is that the current housing shortage and healthcare provider shortage makes opening a new practice extremely difficult. Independent practices are also harder and harder to operate due to reimbursement models from Medicare and Medicaid. This is why you have seen some practices in our area stop seeing those patients. We are truly the safety net for our community, regardless of the ability to pay. What about the ones we are able to hire? Can't we pay them more? I keep hearing. We do our very best to set pay as close to fair market value as we can. Stark law prevents from exceeding fair market value. The law is in place so that we can't otherwise incentivize physicians to send referrals to us, which means they can practice medicine and send their patients where they believe they'll receive the best care. We believe that patients have the right to choose where they go. Stark law helps maintain ethical practice so that patient rights are protected. We've also been asked about what we're doing to help with housing. A lot of your board members know, but just as a refresher, Outer Banks Hospital maintains 12 properties currently that we use for temporary housing for providers and other medical healthcare workers. I want this board to know how much this community has stepped up to let us know about available rentals for our team members. Several of our team members have been helped through the generosity of local residents. I'm also working actively and have been for the better part of a year with developers in Manteo, Nags Head, Codeva Hills, and Kitty Hawk to acquire additional workforce housing for provider recruitment and other healthcare workers. You may also be hearing concerns about us building a cancer center and relocating the urgent care center in Nags Head. We've had this question come up a few times. I know primary care access is a top concern, but so is cancer care. In fact, cancer is the #1 cause of death in both North Carolina and Dare County, and planning for our new cancer center has been in place since 2016. Our community has stepped up to fund a large portion of the project. I am so thankful to our donors who are helping us make a difference for people with cancer in our community. We broke ground on the new cancer center on June 16th, and it was shared that we've reduced the 5-year mortality rate from cancer center by 25% here in Dare County. Prior to 2014, our death rate was higher than the state rate, and that is no longer the case. For these reasons, I know I have your support to continue this work. And because we were outgrowing the old urgent care facility and needed land to expand cancer care for our community, it just made sense to relocate our urgent care center. On the primary care front, the new urgent care building also houses a family medicine practice, and we are currently recruiting family medicine providers for that location as well. Winding down here towards the end of the presentation, I want to clearly communicate that we've been extensively recruiting for primary care physician for 10 years. The data just since 2018 is here, and we've seen 44 candidates presented to our different hiring services lines from the hospital or from the ambulatory medicine world. 9 of those were eliminated from consideration. We do extensive background checks. We look at quality, standards of care. We only want the best providers to take care of our community that we live, work, and play in. 35 candidates have gone through the entire interview process. 14 of those candidates have decided that they were interested in proceeding after the offer was made. And the main reasons, as we've mentioned some, is housing, cost of living, and scope of services and local amenities. 6 candidates have accepted offers, some of those verbally and some now have signed their offers. 2 primary care physicians, 2 hospitalist advanced practice providers, 1 oncology advanced practice provider, and 1 urgent care advanced practice provider. Excuse me. 10 candidates are outstanding with different levels of engagement, and we currently have 2 offers pending for 2 additional family medicine physicians and are hoping to hear back very soon about their acceptance. Any new permanent provider who comes in over the next 3 to 6 months, we've been actively recruiting since well back into 2021. At the risk of sounding a little defensive, we are not asleep at the wheel, and we did not just wake up. I know you all know this, but I just had to say it. The national primary care struggle is real, and it has hit home. I think the ad campaign that we released in January of this year really illustrates our efforts to market the opportunity to come to practice medicine in a beautiful, small coastal town environment. There were others, but this one in particular featured Roanoke Island and was sent to nearly 25,000 primary care physicians as a recruitment tool. I'd be remiss not to mention the ingenuity, flexibility, and can-do attitude of our local team members and our partners who've been working so hard to help. We're constantly evaluating and adjusting to meet the needs of our patients. These are just a few examples. We utilize locum physicians and staff, or we may call them travelers when possible, to fill gaps throughout all of our service lines in and outside of the hospital. From fiscal year 20 through fiscal year 21, 8 months of our fiscal year, we've seen provider costs increase 79%. And team member costs, nurses, MRI technologists, lab technologists, and others, 522%. Or for the first 8 months of this year versus last fiscal year, we spent $1.6 million last year. We've so far this year spent $4.7 million just for these temporary providers and team members. We're utilizing Vidant Now, which is our virtual platform, to help with refills, as well as our urgent care centers and our Center for Healthy Living. Chesapeake Regional Medical Group has stepped up and is assisting with referrals and accepting patients. We're also working with a couple of national organizations, Premier and the Advisory Board, and with ECU and ECU Health to look at additional new innovative models for primary care, including telehealth and advanced practice providers and others, so we can open up as many services as we can locally. So in summary, I'd like to reiterate that we're deeply sorry about the situation at Manteo Family Medicine, and we're working diligently to restore and ideally expand care. There has been ongoing persistent physician recruitment since 2018, and although I've not said much today about the impact of COVID-19, the pandemic impeded every industry, including healthcare. According to a Becker's Hospital Review white paper, the American Medical Association recently cited that 1 in 5 physicians and 2 in 5 nurses intend to leave practice in the next 2 years. With the help of our partners, our civic leaders, and the community, we will create solutions that increase access to primary care. It'll take a partnership and it will take time,